Hey people, this is my lockdown quarantine look. So I'm in my PJs, no makeup, um, working from home. So I thought, let me do a video just to update you, give you an overview of what's going on with Corona. This video is all about a very brief overview on Corona, the immune system, immunity, clinical trials, tests, vaccines, and faith. So, in basic terms, the immune system has two lines of defense: innate immunity and adaptive immunity. Innate immunity is the first immunological, non specific, antigen independent mechanism for fighting against an intruding pathogen. It is a rapid immune response occurring within minutes or hours after aggression that has no immunologic memory. Adaptive immunity, on the other hand, is antigen dependent and antigen specific. It has the capacity for memory, which enables the host to mount a more rapid and efficient immune response upon subsequent exposure to the antigen. I had to take advanced immunology as part of my graduate program. I was overwhelmed by the complexity of the immune system. I failed the first attempt. My professor was kind enough to let me work on special projects which helped me pass the exam. The immune system is incredibly complicated and utterly vital for our survival. Several different systems and cell types work in synchrony, in harmony, to elicit an immune response to fight off pathogens and clear up dead cells. Diagnostic tests like the traditional culture, serology, and molecular testing methods to detect antigen, that is the virus, and antibodies, that's the immunoglobulins produced in response to virus, using modified influenza testing algorithms are being developed for COVID-19. Vaccine testing proceeds slowly because the human body responds slowly. It takes weeks to produce the antibodies that provide immunity, and it can take longer to show harmful side effects. With federal oversight, the process typically works through these phases. The first is the animal trials, where a lab tests the vaccine on small animals, usually mice, to see if it triggers an immune response and side effects. And then it goes into human trials called clinical trials. If those animal tests shows that the vaccine safely produces the intended immune response, the product moves to human clinical trials, which involves phase 1 to phase 4. Now, phase 1 involves just a small group, typically several dozen of volunteers, to test the safety of various doses and see if they produce an immune response. And then it moves to phase 2, expanding to more people, typically hundreds, who have characteristics such as age and physical health, similar to those for whom the new vaccine is intended. The objective is to determine safety and immune response in a more diverse set of subjects. Now, phase 3, giving the vaccine to thousands of people to provide data, safety and effectiveness, measured, for example, by how many contract the disease in an area where the virus exists. In the company I work for, Takeda Pharmaceuticals, we are closely monitoring the novel coronavirus, that is COVID-19 outbreak, and the global response. As a company dedicated to the health and well-being of people around the globe, we are committed to taking steps to help those impacted by the coronavirus and try to lower the risk of transmission. To this end, we are initiating a polyclonal hyperimmunoglobulin to treat high-risk individuals. We are collaborating with several health and regulatory agencies and healthcare partners across the globe to move the research forward. In parallel, we are also exploring whether currently marketed and pipeline products may be an effective treatment option for infected patients. We are also partnering with public entities and other pharmaceutical companies, especially in UK, to leverage our collective expertise with the hope of developing diagnostics for COVID-19. Apart from all this, my company support healthcare workers in China by sending medical protective clothing, including masks and protective jumpsuits, to impacted regions. Takeda has also donated millions of dollars to the Red Cross and various hospitals in China. R&D takes time. Efforts are underway to accelerate the process to fight COVID-19. Cure is just around the corner. Now, coming from a background of Christian faith, I have to share this with you as well. Did God create the immune system knowing that we would need it to battle pathogens? Was it inevitable that we would encounter germs? These are questions that creation scientists have pondered for a long time. The overall complexity of the human body and the magnificence of our immune system further illustrate evidence of an intelligent design by a master craftsman, our Almighty God. Can drugs and water, hydrogen, nitrogen, carbon, and oxygen smashing together for millions of years create that? Most definitely not. It says in Psalms 139:14 that we are fearfully and wonderfully made. All things came into being through him, and apart from him, nothing came into being that has come into being. Like said in John 1:3. For by him all things were created, both in the heavens and on earth, as said in Colossians 1:16. The current experiences of COVID-19 is showing us many things about ourselves and our world. God is greater than his creation. He is greater than the virus. Let's not fear. Let's not give up, but have hope in God. God bless, and I will see you in my next video. Take care.